Welcome back, guys. Today we are talking all about carpal tunnel syndrome. And what is carpal tunnel syndrome? Carpal tunnel syndrome is where there is a narrowing in your wrist. So in this part of your wrist, the median nerve and a bunch of flexor tendons feed through. And due to inflammation or compression, the median nerve can get disrupted, and that can cause nerve pain into mainly these three digits, a little bit of this one here, that can come on during the day, but especially at night. So if you're someone that is experiencing you might feel a little bit in the wrist, but you're experiencing a little bit of numbness, shooting pain or anything into these three digits, there's a strong chance that it could be carpal tunnel syndrome. The main causes of carpal tunnel can be due to repetitive movements. And the big one I see in clinic is people who work long hours on the computer. So repetitive movements where the wrist flexors are constantly working, things can get compressed in there. Another one is pregnancy due to fluid retention. So that's a common one as well. And you can also see them in different health conditions such as diabetes, arthritis. So as we mentioned before, guys, the main symptoms are numbness, tingling into these three digits with a little bit of the fourth one. Can also be weakness, so grip strength can weaken. There may also be pain that radiates up the forearm. And with all these symptoms, they can often get worse at night. So treatment options, this can include things such as anti-inflammatories, wrist splints for especially at night, activity modifications, severe cases, surgery, reduction surgery of that carpal tunnel to take pressure out of the area. The number one thing I like to see people do is self-massage. And this can include using a fascial blade, a little bit of cream and some anti-inflammatory cream. I use physio cream, I really love it. And all we're doing here, we can go a little bit on the edge of this thumb, come down into the wrist area. Just like that, and then really lightly. And if you don't have a fascial blade, I'll put a link in the description section to one below that you can get. But if not, you can use the handle of just a kitchen knife, something pretty blunt that you can just use to really lightly scrape and free up some of that superficial tissue. All we're going to do here, guys, use the fascial blade lightly, and we're going to start in a little bit of wrist flexion, slowly moving into extension and dropping off. So we're going to work through each area. You're going to notice that you start to get a little bit of reddening. So where the fascial knife's been, we're sort of freeing things up. There may be a bit of scar tissue in the area. We're trying to mobilize everything here. So in wrist flexion, we can work through this wrist. Just make sure if we do too much pressure, you might feel a little bit of that nerve pain go down into the fingers. So we really want to avoid that we feel any of that nerve pain. So we're going to complete just 15 repetitions of wrist flexion to extension and just trying to mobilize all this tissue, trying to increase the amount of reddening we can see as we go through this area, carpal tunnel area, making sure we keep this extremely light. If we do too much pressure, that's going to be more compression, and that's going to flare up those signs and symptoms. So all the way to 15 reps with this, guys. And with this one as well, you can work a little further up the forearm. So remember, the flexor tendons go all the way up, and we want to make sure they're sliding and gliding really good. So we can move up from here and do a little bit of soft tissue work through all of those. Really good one to start with. Warm the area up, make sure there's good blood flow to the area, and we've mobilized things as much as possible in terms of the soft tissue. Okay, so for the next one, guys, we're going to go into what we call a reverse prayer. So normal prayer, fingers slowly come around to us. And what we want to make sure we do here is we don't feel anything through the nerve distributions. We're going into this position, holding just for 10 seconds. And after that 10 seconds, we're slowly feeding our fingers back up and around as far as we can. Fingers back around then, keeping the heels of the hands together, holding for that 5 to 10 seconds. Slowly feeding, unwinding from here and back again. Heels of the hands pressing hard. And back up, good. So we're going to try and get to 8 reps here. And that's good. So from here, If there was no pain there, the stretch wasn't too bad, we're gonna step this up, guys. Okay, guys, so from here, we're going to come into a standing position. And what we're doing here, placing the fingers facing us, heel of the hands away, and we're gonna start with our body as far over the table or whatever you've got your hands on to start off with. Now, if this is a strong enough stretch, we're gonna hold here for 30 to 40 seconds, trying to use the breath. So focus on the tightest parts of the forearm and use the out breath to try and release and relax all those tight areas. Now, if you want to intensify this stretch, if this isn't strong enough for you, what we can do here is start to rock that weight back. So the further back we come, keep pressing the heels of the hands into the table. This is going to intensify the stretch. So we're going to go through 2 lots of 30 to 40 seconds with this one. And once again, ensuring that we don't feel any nerve pain whatsoever. Another great one, guys, is to do, once again, coming into wrist extension. And because we now know, so that median nerve feeds out into mainly these 3 fingers here, a little bit of the 4th. But what we're going to do here, so that wrist extension is going to stretch the nerve out a little bit. And from here, if we grab the thumb, go into wrist extension, we're going to get a nice stretch here. So once again, holding this stretch for 30 to 40 seconds, trying to pull that wrist into as much extension as possible. And 2 lots of 30 to 40 seconds here. Nice and basic. Make sure there's no pain. No signs or symptoms coming on. So for the next one, we're going to do what we call tendon glides. And this is just going to help where those flexor tendons go through the carpal tunnel. It's going to help mobilize them, get them moving a little bit so things aren't compressed. And hopefully it'll free up that median nerve as well to stop the nerve pain. So we're going to start off with here, keeping the arm flat, keeping the wrist in neutral, so we don't want to extend it or flex. And all we're doing here, pulling those fingers to the bottom, so right to where the base of the fingers go, and holding for 3 seconds slowly out from there. Then for the next one, we're going to pull those fingers all the way in to almost the base of the wrist, keeping that wrist in neutral though. Hold for 3 seconds, slowly going back from there. But then we're going to do the same thing, so the same thing as what we previously just did to the base of the wrist, and then with the thumb, we're going to squeeze as hard as we can, and then slowly release from there. So we're doing 5 reps here. We go back to the start. So fingers going into the base here, and 1. Fingers just here, making a light fist, and slowly coming out. And then fingers coming in, thumb hooks over, making a strong fist, and then slowly release for those 3-second holds on each one. So once again, it's fingers out, fingers all the way to the base of the wrist, light fist, out, and then the same thing again, thumb hooks over, squeeze, make a fist without pulling that wrist into extension or flexion, and then release. So do that 5 times through, ensuring that there is no pain. Another great one we want to do, knowing that the median nerve arises from the spine all the way down the arm, we want to make sure that nerve is sliding and gliding as it should. So this one here we call a nerve glide. What we're going to do here is have the arm out. We're going to extend the wrist here. As we extend the wrist, we're going to side bend the neck towards that side. As we start to, so we're going to hold this for 5 seconds. As we start to bring the wrist back to neutral, at the same time the head comes up from there. So this is the first part, and this is where we're going to start. We're going to do this for a few weeks, 1 to 2 weeks, and if we find this pretty easy, we're not flaring up the nerve whatsoever, then we'll move on to the next step, which is coming up in a second. So with these, we're just going up to 10 reps. We're not forcing it too much. We're going as far back with the wrist as possible, and as you bring that wrist back, it's pulling the nerve down towards the wrist. And then as we go up with the neck, the nerves are getting pulled back up, the wrist is coming back into neutral, the nerve sliding and gliding up a little bit. So keeping things pretty free up until 10 reps there. Now, if that's fine, What we're going to do here now is extend the wrist, start with the neck in neutral, and then as we flex the wrist, side bend the neck away. So slowly go back to neutral and wrist into extension, and then slowly side bend away. We can go into a little bit of flexion with the wrist. So this is level 2. And then level 3, and this is where we start to apply stretching of the nerve, is we go extension, side bending away at the same time. So make sure with this one, we don't feel any pain whatsoever, and we don't start to get any numbness into the fingers. And the same thing, all 3, we're just doing 10 reps. You can do them twice over, so 2 lots of 10 reps, making sure that no nerve pain comes on and that we keep things slow, controlled, nothing forceful, going to the barrier, not through it. Okay guys, so for the last one today, I want to add a little bit of strength in. And we've done this in previous videos. We are going to lock the elbow into the table. This is just a 2-pound weight, so super light. We're going to lock the elbow into the table, have the wrist overhanging over the edge of something, and all we're doing here, slowly dropping down into extension with the wrist, slowly coming all the way up into a little bit of flexion, making sure that no signs or symptoms come back in. And we're going 2 lots of 10 reps with this, keeping it slow, keeping it controlled. If a 2-pound weight's pretty easy, you can go up to 5-pound with this, but we don't want to go too heavy. The idea here is that we're just learning to get control. We don't want to build a bulging huge forearm. So just trying to go all the way as far into extension, as far into flexion, keeping that control. Now, after we do 2 lots of 10 reps that way, we're going to flip the arm around so it's facing down, and guess what we're doing? The same thing. So we drop down, flexion, coming all the way up into as much extension as possible. So making sure we get both sides, 2 lots of 10 reps, very slow, very smooth, controlled motion. If you go too heavy with the weight, you'll notice straight away that as you start to drop, it's going to be stop, start, and it's not going to be a smooth motion. So make sure the weight is light, is controllable, and we're not pushing it too much. So I hope these exercises are extremely beneficial for you guys. So make sure you write in the description section if you want to see any particular videos in the future. Take care guys, and we'll see you next time.